Bismillahirrahmanirrahim. Assalamu alaikum warahmatullah. We are discussing collapse and consolidation of various lobes of the both lungs. Here we have X-ray chest PU view. And this is right upper lobe, right middle lobe, and part of the right lower lobe. Here we can see this is left upper lobe and part of the left lower lobe. On sagittal view we can see this is left upper lobe and left lower lobe, while here we can see this is right upper lobe, right middle lobe, and right lower lobe. This is major fissure and this one is minor fissure, while we can see this is a major fissure on left side. First of all, we are discussing left upper lobe collapse. We can see that there is opacity or a ground glass haze involving upper and mid zone of the left lung, both on AP and lateral view. There is thin strip of air between arch of aorta and opaque portion of the left upper lobe. This is Luftskill sign, which is typical for collapse of the left upper lobe, and air in this region presenting apical segment of the left lower lobe in this area, which can be noted on the lateral view as it shows compensatory overexpansion. So yellow arrow indicates air in this region, Luftskill sign, while we can see red arrows on lateral views shows a triangular density with loss of the lung volume and homogeneous opacity favoring collapsed left upper lobe. Here we can see right upper lobe collapse. A triangular density is noted involving upper zone of the right lung. Red arrow indicates lifted minor fissure on PA view, while there is another density which is marked with the yellow arrow representing mass lesion in this region. So when we combine straight lifted minor fissure with outer margin of the mass lesion, it represents reverse S sign of golden or golden S sign, which means that there is a mass which shows bulging outer border and upper portion represents lifted minor fissure, giving an appearance of reverse S sign of the golden or golden S sign. Similarly, we can see on lateral view interior red arrow indicates minor fissure, while posterior red arrow shows upper portion of major fissure. Here we can see triangular density is appreciated in right pericardic area with indistinct intervening ciliates, that is margins. Right cardiac border is obscured, suggesting positive ciliate sign, and this is collapse of medial segment of the right middle lobe. On lateral view we can see band like collapsed middle lobe overlaps on cardiac shadow. Here we can see homogeneous shadowing is noted in lower zone of right lung in both cases. Basically this is combination of collapse and consolidation of the right lower lobe. We can see that right heart border can be seen through this opacity in both cases, while there is obliteration of right diaphragmatic contour in both cases. So ciliate sign is positive, favoring involvement of the disease process in lower lobe of the right lung. This is another X-ray where we can see triangular opacity or triangular homogeneous density noted in medial portion of the right lower zone with a sharp major fissure, and we can also see that diaphragmatic ciliate is also obscured over here. So ciliate sign is positive, while there is overexpansion or compensatory overexpansion of the right middle and upper lobe. This is another example where we can see triangular density is noted behind left heart, which is a typical presentation of collapse of the left lower lobe. Another example with extra density noted through left heart on PA view, while in lateral view we can see this extra density is involving left lower lobe, which is collapsed in this view. Here we have coronal reformatting of post-contrast CT of two different cases. We can see collapse and consolidation of the left lower lobe in both these cases. Here we can also see crowding of vessels in collapsed left lower lobe. Same patient, we can have axial view where there is a triangular density suggesting collapsed left lower lobe, and here it is a sharp major fissure, and this is sagittal reformatting. We can see collapse and consolidation of the left lower lobe. Thank you very much. Assalamu alaikum rahmatullahi wa barakatuhu.